Thank you all. A few things to mention first. I'm Christopher Ann, not Marissa Kozielski, if you saw that in the agenda. So if we talk to one another later, that's my name. And second, as a bit of a joke, but I did not, financial disclosure, did not pay Dr. Berry to say any of the things in his talk earlier that are going to lead exactly into a lot of things that I want to share with you today. So we're going to talk about the NICU of tomorrow, at least from AngelEye Health's perspective, and harnessing sensors at the bedside. So I'm not going to focus a lot on this slide so I can catch up a bit, but I realize that you guys know a lot of this data much better than I do, or that our team does, but really wanted to let you know that we focus exclusively on pediatric populations and really specifically neonatal populations. So we're addressing and working with the same populations that you guys are, specifically in the NICU. A bit of background about our company. You may know about us already, but just to sort of level set, we started out by providing on-demand streaming video for families to allow them to be with their neonate when they're not able to physically be there during that time. We expanded that to provide education and communication services over time that really allow, again, the family to communicate and understand what's going on in the NICU. Later, we added a product called Milk Tracker, which does feeding management, all the end-to-end feeding documentation, so that we ensure that orders that are put in the medical record are in fact followed. And then NICU to Home's our newest offering that really allows the family to navigate the NICU, to be empowered, educated, and understand what's going on, so that it's both not a burden to the bedside staff, but also lets the family understand what's going on as they move through the process. So a little bit about our footprint and our family engagement. We're in about 250 hospitals right now, have about 10,000 cameras deployed at the bedside, and families really engage in our application. One of the things that I'm going to take from Dr. Berry's presentation was that crazy sort of picture of all the boxes, that are all sort of, some of them aligned, some of them difficult to get to, and that's sort of how we think about the patient portal for the family. We know that families don't really log into the portal all that often, and when they do, it's overwhelming and confusing. So NICU to Home is our tool that really helps guide them through that process. You can see that families engage with our solutions on average 5 times a day, and for 20 or more minutes a day, depending on what solutions they have at their facility. I'm going to talk a little bit about the NICU of tomorrow, at least as we see it. As I mentioned previously, we're right now, as you can sort of see in the green text here, these are things that we're already doing. We're working with the bedside staff to help improve operations, how they interact with families, trying to reduce phone calls, for example, by giving information to the family so that they understand what went on that day. So family updates through the NICU to Home platform. We're enhancing clinical workflows through our tool Milk Tracker, which again allows the bedside staff as they're prepping milk or in central prep to follow the order and ensure that there's no risk from safety or any kind of misfeed from that perspective. We really want to leverage all of this data that we're now getting with the tools that we have deployed and some of the other things that we will be doing in the future, and some of the things that many of you guys have already spoken about and where you're innovating. So we want to improve quality and safety. And ultimately, as again, many of you have spoken about as we've been here, create novel algorithms that really pull all of this data together and give you insights that you otherwise would not have. So I'm going to focus now on our first indication. This is a product called EDNA. This is a neuromotor risk assessment. We were fortunate enough to acquire this intellectual property from a company called Enlightened Mobility. That's Marissa's company, who wasn't able to be here today, but I'm looking forward to telling you a little bit about this. So from our perspective, there's really an access problem to a screening tool in the NICU. Again, a lot of this data you guys know better than I do, but about 15% of pediatric patients have some kind of neuromotor condition in their life. And unfortunately, only about 2%, very low percentage, are diagnosed while they're in the NICU. Why is this? Right now, this is a manual test. Again, many of you know about this, but there's general movement assessment and many other exams that can be given at the bedside, but training is difficult, and there are just not a lot of individuals that perform these tests. So in about 3 minutes, we can put a neonate on a mat, detect what kind of movement patterns they have, and put them into a high or low risk category for one of these neuromotor conditions. which would, of course, trigger further diagnostics at that point. This is really, really closely aligned from a sensitivity and specificity perspective to the GMA and other assessments that are done right now. So while we know it's very complicated, our goal is to help you detect these kinds of things early on so that we lead to better long-term management and hopefully better outcomes for these kids. I'll just talk a little bit about the research behind EDNA and maybe more broadly and what we do. Right now, we're completing a study driven largely through Nationwide Children's that's collecting data in 5,000 patients. We call this the 5,000 Babies study. Right now, we're, as you can see, pretty far through that study. And we have about 6 million sensor frames that we've collected in that study. This is clinical data, camera information on these neonates, and mat information through these sensor mats. So we're not only further validating the hundreds of patient data that has gone into the development of EDNA, but further validating it with this data and working on some future algorithms I'll talk about just here in a minute. Again, the other exciting thing from our perspective is we have about 10,000 cameras at the bedside that will allow us to do continuing collaborations with guys like you as we look into other indications that may be of interest in the future. So that leads me exactly to this slide. Right now we are working on EDNA, as I mentioned, and it's a screening mat-based tool for identifying these neurological conditions. We're already doing other things with our camera beyond just family engagement, recording events, for example, for QI and training purposes. We've been working on some virtual rail applications, so we're really excited about those. In sort of the medium term, we'll be transferring a lot of this onto our camera, so going from the mat to the camera, and we know that in the real world that'll have some challenges, so we're looking forward to tackle those as we get into the real world application of that. And then continuous monitoring applications, which again have been talked about in sessions over the last couple days that we're really excited about. As you look further out, again, I think Dr. Ender mentioned some of this just the other day, but there's some research going on in using computer vision, to really understand pain assessment at the bedside. So there's some really neat things sort of longer term that we would really like to work on ourselves and collaborate with you guys about. So that's my call to action. If you're working in one of these areas, please come see us in our AngelEye booth, and just remember that I'm Christopher, not Marissa. So thank you guys.